Hey, Merry Christmas. It's behind us. We have the new year coming up this week. And I'm really excited to share an interview with you today with Paul Wilfert. Paul had a total knee replacement done about 6 weeks ago. I'm really excited to find out the details of his story, what was going on before, how he decided to have knee replacement surgery. He's a fairly young guy. And then what the rehab's been like, what the surgery felt like, and how he cascaded into the rehab. So without further ado, let's hear it from Paul, knee replacement surgery. All right, Paul, let's start at the beginning.
Let's
Um,
start. Is
when
PJ ready?
PJ's ready, we're good to go. We have all the crazy stuff ready for you. What what was your young guy to be having so much trouble with your knee? How did it all start? Did it start with an injury or is it just a gradual thing? What caused your knee problems?
Okay, so good question. And I don't, I wish I knew exactly what caused it, but the best, so I'm a teacher. I'm a PE teacher. And I know like when COVID, when the classrooms in Phoenix were online because of COVID, so that was like 2020. I would go to the gym, my gym at work, to do online class. And I remember it was lonely, right? It was boring, lonely. And I just felt I was so uncomfortable after, like, it was a gradual thing. I was just so uncomfortable, right? And then, I like to go hiking, like, for exercise. I like to go jog 2 to 4 miles a couple times a week, nothing crazy. Um, and that it just slowly became uncomfortable. So when I was working, doing this online school, I would try and um, be enthusiastic for the little kids on the computer, because we're using Zoom, and sometimes I'd get on the floor, like on the gym, and kind of to show them what I wanted them to do, and it was kind of fun, kind of fun, kind of goofy, but I gradually thinking, oh man, I can't get off the floor.
Yeah.
Like, my knees just started hurting, and they were both my knees. And then and this is a gradual thing. So this is about 2 years ago. And then I got some knee braces, right? I ordered online. I'd wear them when I go hike. I didn't wear them all day, but I'd wear them when I go hiking. I'd wear them if I went jogging in the morning, and they helped. But it helped um, like it made it more comfortable when I did the hiking or when I did the jogging, but it didn't like make it comfortable throughout the whole day.
Hmm.
So it helped that way. And then and this was like, months at a time, right? And then I went to see my personal doctor, my family doctor.
Hmm.
He's a great guy, Dr. Jason Turner. And I talked to him about my knees, and and we got x-rays. This is like 2 years ago. And so he's like, why don't you go to physical therapy? And why don't you here are some stretches I would recommend. And I did that. And I'm not sure if I assumed it helped a little, but I went through that for a few months. But I just, I played pickup basketball, and and like after, with my friends, nothing intense, and I was done after like 30 minutes. Like, oh man, I need to sit out. But I like to exercise. I don't want to gain weight. So I did it because that's what I do, right? Then hiking. And this is like I was doing PT like twice a week, but when I would come down like Piasco Peak, I was like one step at a time. One like I put both of my feet on a step while going down. And I just, these gradual things. And then sooner or later, I stopped jogging. I kept hiking, but I stopped jogging. I kept playing basketball because it was kind of fun, and being with my friends. And if I thought, man, if I was going to be uncomfortable, I'd rather play basketball than go jog, down the road. So these were all like things that went on for about a year, over a year. Then my wife, Miranda, who my wife who works for you, she's like, you should go see an orthopedic surgeon. And this, Polly's like, she's like, what I hear from patients and from my coworkers and doctors is like, your knees are not doing well. So I went and saw Dr. Moore and at Phoenix Spine and Joint over in the West Valley. And I really enjoyed Dr. Moore, right? He did great. Like, he really did a good job listening, and he talked to me and he listened and listened and listened. And so he thought, he told me some things, and I thought, man, do I need a new knee? And he's like, not yet, hold on. So he's like, he's like, I need new x-rays. And we talked about an MRI, and he's like, I just don't think the insurance would approve an MRI until we do like an x-ray first. He's like, we can try it. But so I think we actually did try to get the MRI, but the insurance wanted an x-ray first. And I'm not sure, but also in the first appointment, so we talked about an x-ray. Then we also talked about a cortisone shot. Is that what it's called?
Yeah.
He's like, that will probably be the first step of treatment to help with the discomfort. And then there's some other options. So I said, okay. So anyway, again, and this is, I think, a year ago. This is about 1 year ago, I think, starting in January or February.
Yeah.
So I kind of I saw it. So like 2 years ago, I felt this discomfort coming, and I was dealing with it for a while. I saw my family doctor. I did some PT, and nothing, it just got worse and worse and worse, little by little. And then sooner or later, I didn't tell you this, then sooner or later, I just stopped all exercising except for walking. So I was literally just walking in the morning with my dogs or with my 1-year-old. And even then I was like limping by the time I was done, just like walking 2 miles. Anyway, so I see Dr. Moore. And then I get my x-rays. We go back for a follow-up visit, maybe a month or 2 months later. And then he's looking at my x-rays, and it was kind of interesting. The x-rays didn't seem too bad. He's like, man, looking at your x-rays, it's like, it doesn't seem too bad. He's like, it looks like you have some cartilage, but it's not like gone. So he's like, it looks like you have some cartilage there. So he's like, I really think the cortisone shots, he's like, I would rather, he's like, I think you should do these, I don't know the proper word, Dr. Lieberman, the gel shots that really lubricate your joints.
Right. Hyaluronic acid.
There you go. I can't spell that, but
yeah,
that's what we did.
It's not an easy one.
Because he says like,
right.
if you have that much, if you have enough cartilage in there, he's like, it looked like you do.
Yeah.
Like those gel shots should work. So we tried to get those, but then the insurance declined it.
Oh God.
So then he's like, let's get those cortisone shots. So I come back, I don't, like probably a few weeks later, I don't remember. And again, every time I see him, he wants an update of my knees, and he's a great listener. I think that's why I really like Dr. Moore. Anyway, I get the cortisone shots on a Friday, and they worked immediately. I went hiking on Saturday over to Prioscola Peak, and I went up and down with zero discomfort, and I haven't felt that. I think I was even a little emotional when I got in the car because I had not felt that good in 2 years.
Yeah.
And then I went and played basketball, I think, with my friends on a Tuesday morning. But then like 2 weeks later, I felt that maybe like a week and a half later on my right knee.
It's all back.
It came back. But then my left knee, because I got them on both my right and left knee, my left knee, the cortisone shot, I think probably worked for like 6 weeks, maybe 7 weeks, which was interesting. But my right knee, it didn't, when it worked, but it just didn't last very long. That was my experience. So then I went back to Dr. Moore, told him about my experience with the cortisone shots. And then he's like, hey, I really think the gel shots would work. But then what happened? So then, hold on, what happened? Before I saw him with that appointment, I started feeling more pain in my right knee. So it was like, it even got worse, like between some of these appointments. And it was like a sharp pain in my right knee. So I went to see him to talk. I think I went to see him to do like a formal meeting to get to get these gel shots approved and moving forward. But I said, Dr. Moore, I got this sharp pain in my right knee. It's like, it's it's like intense. So then he's messing with my knee, and he's like, if that's a torn meniscus, he's like, this gel shot's not going to work for your knee.
Yeah.
So he's like, we need to stop everything, and you need to go get an MRI ASAP. So I went and got an MRI like the next week, and it showed just for my right knee. So we kind of put my left knee off to the side for now, working on my right knee, and it showed like the torn meniscus. Then it showed like it was a little different than the X-ray, which was interesting to me, but and a little interesting to Dr. Moore. But it showed like just a sliver of cartilage in my knee. So, and then I had like, and so obviously my knees were arthritic, and then I had a bone spur in there, and so I guess Dr. Moore's best guess with the X-ray he's like I guess he's like when you stand up straight, and maybe when you kind of lock your knees, maybe your cartilage kind of gets squished together, and it made it look like more than you actually have. But it was deceiving. So he's like that, and anyway, he's like, Paul, so we talked about it. He's like, we could fix the meniscus. He's like, but your arthritis will still be there. We can kind of mess with that bone spur, but your arthritis will still be there, and you have no cartilage. And he's like, and he's also 43 years old. And at the time I was 42. Maybe I turned 43 at the time. And he's like, I'm the same age as you. I have kids like you have. I like to hike for exercise. You're a PE teacher. You're around kids. And I love to coach soccer. I like to coach my kids outside of work. And he's like, I know you're young, but we really need to talk about a full knee replacement. So that was, I'm not sure when that was, earlier this year, right? So I'm like, okay. So then, man, I don't know. So then I think I came back a couple months later to get gel shots just to see if that would take away the discomfort. And I got the gel shots, and they didn't work for me. And I got them on my left knee and my right knee. They didn't work for me either knee. Like I didn't. Maybe like 3 weeks in, I think I told my wife. I said, "Oh man, my knees feel pretty good." And she's like, "Hey," she's like, "the gel shots don't. It takes them a couple weeks to work." But I think it was like a 1 day thing. I think the discomfort came back in a day. I think it was just a 1 day thing. I don't know.
Yeah.
So we said, and so after I got the MRI and we talked about the extra pain I was getting in my knee, I was kind of not gun ho, but we really focused on getting a full knee replacement. And then I made the date for November 17th and got it done.
Okay. Well, that's what I want to focus on next is I want to give people a sense of what's it like to have a knee replacement. What was it scary?
Dr. Lieberman, I'm sorry. Let me be more specific on why I decided to do that. Because, I feel like I've always been active, right?
Right.
I like my job. I like being a teacher. Like, I don't want to not be a teacher. I don't want to I want to keep coaching, my soccer teams, because I like that, right? I want to go hiking, that's the stuff I like. So that was like a big discussion with me, Dr. Moore. He's like, if you didn't have physical hobbies that are physical, or your job didn't depend on you being on your feet or being physically active, maybe we could do a different route. But it's kind of, I'm not ready to change. And I have a 1-year-old at my house, right? So I'm not ready to change too much of my lifestyle.
Right.
I don't need to go run a marathon anymore. I don't need to go run races anymore, but I sure want to be able to be on my feet and not in next year, I want to be on my feet and not feel like my knees are going to die, at the end of the day.
Yeah.
And with my kids and not feel like I'm worn out in 5 minutes.
Yeah. When I listen to your story, a lot of people, it's the pain that kind of motivates them. They want to get out of pain. I'm not saying you didn't want to get out of pain, but it sounds like for you, the primary motivation was you saw that the life you wanted to lead was not going to be within reach with the old knee that you had, given the severity of the arthritis. And then the MRI showed, unlike the X-ray, which understated the arthritis, the MRI is more sensitive, and it really showed the severity of it. And so there is nothing else. You tried everything else. You tried the therapy, you tried did the hyaluronic acid injections, you tried the steroid injection, and none of it got you to where you needed to be. And so,
Yes.
kind of like
Yeah.
to lead the life that you have chosen, there really wasn't any other option. And so that's what you decided to do.
Yes. Well put. Yeah.
All right. All right. Can we talk about the surgery itself?
Yeah.
So what's
Yeah.
that like? What's that like? You wake up that morning of surgery. Are you like, oh God, I can't believe I'm doing this? You're
Yes.
43-year-old guy. Did you think about canceling when you got out of bed?
Yes.
So what was that like? What did that feel like?
Not the day of, but like the week leading up to it. Like, oh
Yeah.
my gosh, I can't believe I'm getting a knee. Like when I was 21, I had an ACL repair. Right.
Right.
That's the extent of my That's the extent of my injuries. Right.
Yeah.
But yeah, I was nervous. I was nervous getting a knee surgery and like, man, having my leg cut open, like kind of having my leg cut open,
Yeah.
like getting new parts in my knee. Like,
Yeah.
I was nervous. And then I wasn't quite sure, like your staff, Dr. Moore, friends who have had it, they try and tell you what the rehab will be like. Oh man, like, and then I have to take off work, which I've never really done. I've never done before. Yeah, I was nervous. I'm like, Nate, and then it seemed like the week of, like, oh, my knee feels pretty good. Maybe I don't need a surgery.
Yeah.
But
Yeah.
no, we got it was a Thursday morning, and we went in, and everyone, like, we got there, and I got checked in at the surgery center, and everything seems so fast. I think I worked with Courtney, I think, and maybe not. I forget, right? The nurses were, they talked to me at the very beginning, got me ready. They were I thought they were very helpful. And then, and I don't know. And then, so I'm just I'm in my room waiting, or my area waiting.
Yeah.
A couple nurses come in, they take care of me, they got me ready, they talked about they told me what to expect. But and then then the anesthesiologist came in, and he talked. I think he talked more like he talked to me like I knew what he was talking about. And so I had to ask him again, like, hold on. I'm like, why are you giving me 3 separate things if you're just gonna put me to sleep? He's like, why? We don't want you to wake up in the middle of the surgery. And I'm like, okay. So he's like, so this thing will last 45 minutes, and then I'm doing this other thing. And then I'm like, well, if you're gonna block the knee pain for 45 minutes, and then why are you doing that? And you're gonna put me to sleep, then why are you doing this other thing? Anyway, I don't know. So the next thing I know, I remember what happened after that. I fell asleep pretty soon. Right?
Yeah.
So then I woke up, and I did not have a great experience directly after my surgery.
You woke up in pain?
Yes.
Oh.
Not in the middle of surgery, but
Right.
after the surgery. It was all done.
You don't remember going into the operating room? You don't remember them putting the mask on your face?
Yes, I vaguely do.
Vaguely.
I vaguely do.
And then it's like you fell asleep.
Yes.
And when you woke up, you're back in that same recovery room bed. But you're feeling tremendous pain.
No. I was already, when I woke up, I was where I started in my room. You know what? Hold on. I don't know.
Yeah.
That's what I think I was. I think
Yeah.
Started.
Right.
Okay.
Right.
That room where I started it.
But your knee hurt.
Oh yeah. So I woke up. I'm like, oh, my knee hurt. I said this. It hurts so bad, and I think that's what I just said over and over again. I wasn't yelling it or anything.
Yeah.
Like, oh, it hurts so bad, but because I think a nurse woke me up. I remember a nurse being there. So they might not have woken me up, but I remember a nurse being there. I'm like, it hurts so bad. It hurts so bad.
Yeah.
Like, well, Paul, we're gonna get you on your feet. I'm like, it hurts. It hurts so bad.
It. Yeah.
So, they sat me up, and they're like, "Hey, let's get your walker." And I just kept saying, it hurts so bad. But they got me on the walker. They got my wife. She was not in the room. And they're like, "Hey, let's get the car." And they got me in the van, and I came home.
And they just kicked you out, huh?
Yeah, yeah.
Wow.
And I did, and yes, I felt like they rushed me out of there, to be honest. Or,
Yeah.
again, I was kind of loopy, right, because of the medications and
Yeah.
the pain blockers. Um,
Yeah.
but my wife was there, and even at the house, it hurt so bad until
I
I got
know.
my pain medication. And it was interesting. Like, I looked at the like, and it was funny, like how they got me in the car. I don't know how they got me in the front seat of the car,
Yeah.
because it took me like 2 weeks to be able to get back into the front seat of my van.
Yeah. Yeah.
With
Well,
all
you
the
had a
heat.
lot of numbing in there.
It's like
Well,
I
and
think I just
Paul,
like smashed it in there.
Paul, no one can tell because you're sitting down, but you're a tall guy. How tall are
Yeah,
you?
I'm almost 6'6".
Yeah. So you're super tall and strong. You're a muscular guy. So that is a lot of force on that knee. And I could see how getting up when you're 6'6", I'm only 6 feet tall. I think it would be a lot harder if I was 6'6", and it would be a lot easier being 5'4", right? Like someone who's
Yes,
5'6" is a full foot shorter than you. So I could see
yes,
how it's going to be extremely challenging for just the leverage on that knee every time you get up, every time you move. That strikes me as a painful and difficult. It's going to be a difficult recovery. All right, so you made it home and you were in a lot of pain, but you have a good wife. We both know that for sure. And so she nursed you through this thing. And how's it going now? Are you back to where you can walk? Does it still? So it was November
17.
17th, and today is December 26th, 27th. So
So I think
you're
Thursday will be 6 weeks.
Thursday will be 6 weeks, and today is Tuesday. So how's it going now? Where are you at? Can you walk? Like, what can you do?
Okay, so I went from when my progress was from a walker,
Hmm.
which I really fought my wife about. I said, I don't want a walker. I don't want a walker, but yeah,
Yeah,
a friend, a coworker is like, Paul, you're gonna need a
you're gonna
walker.
need a walker, buddy. You're
So,
6'6". Yeah,
so I had a walker.
yeah.
I went from a walker for about 2 weeks, and then maybe a couple days extra. And then I went from like a hobble, then I could hobble a little bit,
Hmm.
like not even a limp. And then I went to a slow limp, and now I walk with a limp.
Hmm.
And so I use crutches. So I went from the walker, and when I could hobble, I used crutches, so I could have a better like walking motion,
Right,
you know.
right.
Then after a week of crutches or 10 days of crutches, I was like, oh, I could actually walk around pretty good
Hmm.
with a limp, you know.
Hmm.
So I get around pretty good now, but the physical therapy. Okay, I was not ready for the physical therapy. Like, we
Uh,
got it set up. I was not ready for your patients. It was so painful. It is so painful. Not the whole thing, but the Dr. Moore and everyone,
yeah.
the therapists,
They range
they're
that
like,
knee.
you need to practice bending your knee.
Yeah,
You have to, or it's not going to come back on its own.
right.
So there's every therapy session I have, they have exercises that I do, stretches I do, but then there's like, I'm not sure how long, about 7 minutes,
Hmm.
where they're like, hey, get on your stomach. We're gonna push your knee back as hard as we can,
Hmm.
and it is so it is so painful, but
Oh,
it's needed.
yeah.
And then to be able to do that and to get myself, I can't get it that intense at the house by myself,
Hmm.
but to even like get myself in that much discomfort on purpose, for my stretching,
Yeah.
it's not easy, right? It's like,
No.
because I know I
Yeah.
have to do it.
Yeah.
So the physical therapy work, I underestimated it.
Yeah.
I did underestimate it.
Yeah.
And I went and saw Dr. Moore, like a 2-week follow up, and he was really good. Like, we had a very open conversation about how I thought what happened after the surgery,
Yeah.
and so we had a very good conversation about that. But then, we talked about my physical therapy, and he's like, Paul, he's like, after about 3 months, so he's like, about 3 months, that's your time to get most, like, 95% of your motion back. And he's like, after that, it's very, very difficult. So he's
Right.
like, you have to do it. You have to do it every day. He's
Hmm.
like, it's more important than going to work. It's more, you have to do it every day. So that kind of scared me a little bit. So I made sure, because he thought I was a little behind on that 2-week follow-up.
Yeah.
So, so the physical therapy, I underestimated that on the discomfort, but also
Yeah.
how important it is. But now today, I walk around. which is what, and the therapist tell me, also Dr. Morris, like, you need to walk around,
Yeah.
you need to be on it, but that's also not the same as stretching it and doing the exercises.
Right.
He's like, you have to do both.
Right.
So I was okay. So now I can walk. So I'm not working. I take time off work to heal, but I still been coaching my soccer teams. So as an example, like, I'll go for like an hour and a half, and my knee feels not bad for about an hour, but there's not a real gradual. It doesn't like gradually get tired.
It just
It's like,
falls off a cliff.
Good. And then all of a sudden it's like, oh, I'm done. Like,
Yeah.
I need to sit.
Yeah.
So that's kind of what it's like. And even now, like, another example, I'll take my little kid, put him in the stroller, and go for a walk around the neighborhood. I've been trying to go longer, but I feel good, and I'll walk. I say, oh, actually, I feel pretty good, and I'll walk a little extra further. And we're like talking like a mile or a mile and a half now. But there's a point where it's like, oh, my knees, like,
I don't know if I could get home.
Yeah. Like, I have to get home now. So it's interesting that there's not a big time frame of it just gradually, my knee gradually getting tired and starts to ache even worse. Like, it starts to ache. It just kind of happens.
Right.
And another example, like, it was, let me back up for your patience. What I didn't also realize, and I don't know why, is my surgery was on my right knee, so I couldn't drive. So that was a big inconvenience.
Yeah, it's a big inconvenience.
So I'm lucky enough to have, I have my wife, and I also have older kids who drive. But man, like, that was really inconvenient. And then also, so when I could drive, I'm like, oh, I want to go run an errand, or I want to run a couple of errands just to get out. But I go to the grocery store, to Walmart, and I'm like, I'm ready to go home. I need to ice my knee, because it feels good and it just doesn't.
Yeah.
All of a sudden.
Yeah.
And it just gets worn out. So,
well, I'm really glad to hear your story so far, because, we sort of, with the minimally invasive techniques and the robot, we act like this is not a major surgery, but for a lot of people, they do experience a recovery just like yours, where it is definitely a major surgery. And the recovery is slow and painful, and it's critical. That I'm so glad, Paul, that you're sticking with it with therapy and getting the range of motion. The only way to screw this up is to not commit to the rehabilitation, and then you get 3 months out and you don't have a good range of motion. So I'm very interested in where you are today. I think it's very helpful for our audience to hear about the struggles that you're having. But I'm also very interested in following up with you at 12 weeks and seeing where you're at. When are you going to go back to work?
Okay, well, I was scheduled. Well, my goal was to go back January 9th, which is a Monday. So 2 weeks from yesterday. I would like to go back to work then. I don't know, but it's funny.
Be ready. Yeah.
I don't, and I want to go back, but I don't want to mess my knee up, and I don't want to be at work for like half the day,
right? And
then not be able, then have to sit down for the rest of the day,
right? Because
I'm a teacher. I got to be up on my feet.
Yeah.
So I might have to push it back a couple weeks.
Yeah.
But and 6 weeks was kind of the sooner end, I think, of the average.
Right.
I was like, Dr. Moore, I think he first started like 12 weeks. I thought 12 weeks. He's like, well, he's like, you sooner, but you don't want, like, you need to recover. Like, you need to make sure
you're 6'6". I mean, yeah, you're a long way from the ground, big guy. I mean, like, I just don't see how you could possibly not be putting so much more force on that joint than some of these little tiny old ladies who have these surgeries. And so it's good. All right, well, let's see what happens.
I do want to go hiking, though. I did talk to Dr. Moore really quick.
Oh, what did he say? When can you hike?
I really want to hike the Grand Canyon again.
Yeah.
And he's like, oh, you should. He's like, no, Paul. He's like, I'm not kidding. He's like, you should hike the Grand Canyon again. He's like, in a year or so. He's like, anything like, moving forward, like hiking, jogging forward, even like a running forward. He's like, your knee's solid. He's like, you just have to wait. You got your tissues, right? Your soft tissues have to heal. Yeah. Your muscles have to heal.
Right.
And he's like, you should be good to go. And he's like, I would stay away. He didn't say, he's like, you could probably handle basketball, but he's like, I would stay away from the pivot sports, anything with the cutting side to side and twisting of your knee. He's like, I would recommend staying away from those once you're healed, but he's like, we'll worry about, he's like, but move, like anything that's like jogging forward or just hiking. It's like, you should be good to go. So
You know,
that's my goal next
we
year
follow
is the hiking.
I don't know, are you participating in the Striker portal and entering your pain levels and everything? Or are you not doing that?
I started doing it, the app. Hold on.
The app, yeah.
I started doing it, and then I don't know.
Not for
I
you.
think I had some problems with the app.
Okay.
I don't know. I just
Yeah, I mean, everybody's different, but a lot of our patients, more than 90%, do follow their progress in the app. And the nice thing about that is we do have a pretty good marker, a reference for how people do. And 6 weeks is definitely the inflection point for a lot of people. A lot of people kind of struggle for the first 6 weeks, and then it really kind of turns around and they just start racing out of it. So it'll be interesting to see with you, Paul, how the next 6 weeks go for sure. I would think of the first 6 weeks as one block of time, and then this 6 weeks as another block of time. You know how many of our patients still have severe pain at 12 weeks? None.
Zero. That's
Zero.
what I'm looking for.
Zero. Yeah, it's really, but that's at 12 weeks, which is double where you are today. So you're not even 6 weeks until a few days from now. So really, I mean, and think about how far you've come from that moment you woke up to where you are today. What if you made that same amount of progress from today to 6 weeks from now? You're going to be killing it. So I think you're in a better, you've come through a lot, and I respect that, but it's, you have a lot of additional gain to make. And I see that happening to you in the next 6 weeks. I'm gonna be very interested to see how it goes.
Sure, Dr. Lieberman.
All right,
Sure.
You're gonna come back and talk to us. Can we film you
Yes.
when you're back at it? We want to get you out there with those kids doing your thing.
So do I. I want to be out there too.
All right, we'll stay in touch and we'll talk soon, okay?
Thanks, Dr. Lieberman.
Thanks for being with us, Paul. Really appreciate it. Very helpful to others. If you have a question you would like answered on Best Practice Live, click the link to our website and complete the submission form. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health.